we use nutrition as an intervention. There's a difference. And the way we manipulate the food and the timing and so on. We have a restaurant on site. We have a culinary nutrition center on site. We have a grocery store on site. And all of these are tools that we use to work with our patients to help them to use nutrition in an effective way to help their bodies heal itself and help them control and really reverse these chronic illnesses. Hello and welcome to Montgomery Heart Wellness. We have another clinical rounds here at MHW, and today we're going to talk about a man in his 70s who was morbidly obese and wanted to just simply improve his health. So Camille, what can you tell our audience about this patient?
So yes, he had morbid obesity, a lot of leg swelling, lymphedema, arthritis, gout, type 2 diabetes, high cholesterol, high blood pressure, everything really.
It's a laundry list.
Yeah.
My goodness. What?
So naturally was on a lot of medications for all of those things, and he really wanted to lose weight and start to actually improve and reverse these health issues rather than just dealing and having to live with it every day.
And many of you in our audience can probably identify with this man because he's 72 years old. He's not old, but he's not, spring chicken. And so has a lot of these health problems, especially being morbidly obese. And not only is he obese, but he had, arthritis. So oftentimes people think, well, gosh, how can I lose weight? I can't exercise, my joints hurt, I can't move. But the point is simply, here's a person who's in many ways trapped. How can he start to lose weight? He can't exercise. Plus he has medical problems with diabetes and high blood pressure. And so he come to us wanting to make changes.
Yeah, so he did start right away on our plant-based detox. He was very motivated and he really stuck to it. He only ate between 11 and 4. And after just 1 week, we stopped his statin for high cholesterol, stopped his metformin for type 2 diabetes, and also stopped his meloxicam for arthritis, stopped the allopurinol for the gout, and stopped one of his blood pressure medications.
All within 1 week.
Mm-hmm.
So basically you start the nutritional detox. And again, we put a big emphasis on nutritional detox because individuals like him who come in and you're morbidly obese, you can't exercise, you can't move, you have arthritis, you're sort of stuck. So the initial therapy, at least in our experience, and it's not just for someone like him, we'll share other patients over time, but the first break in that is to nutritionally cleanse the body. Mm-hmm. And the detox, and medical literature shows this, in just 4 weeks on a nutritional detox, and I like to describe it as a defined plant-based or defined meal plan, is that inflammation goes down. We see on average about 30%. Blood pressure comes down, cholesterol comes down, and these changes happen really within a week. And so the fact that he was able to come up with these medications within a week is important to note because we know that these changes start to happen within the first week. We published over 4 weeks, so then that allowed him to come off the medications. And then also within that week or so, he has less pain, he then becomes mobile, then he's able to move and exercise.
Right. Yeah, I think that, starting with nutrition first is the main thing because some people exercise a lot, but they eat whatever they want, and that's not good.
That's right. And some people get away with it when they're young, or at least they think they're getting away with it. They're not probably truly getting away with it, but they can eat bad food and exercise. But one thing we like to emphasize is that it's not the calories in the food, or perhaps not just the calories in the food, that's a problem. In fact, the calories are probably the least problematic part of the food, of bad food. The most problematic part of the bad food is the abnormal biochemistry, So lots of people think that in certain people in this man's condition, if I just cut back, I'm only eating one. We see a lot of people, I'm only eating one meal a day. I'm going to cut back. But you can't simply cut back. You have to cut out. Okay? Cutting back something that's bad is just still having something that's bad.
Yeah.
You have to cut out. And so when you cut something out, then that's when it allows the body to heal itself. And it can't just cut out mostly. It has to be 100%. I really want to emphasize that for him, because lots of people go on these little, binge diets or whatever they're doing, but they're not doing it in a defined way. So he completely cut out animal protein, processed foods, and even cooked foods. And then he did the time-restricted eating, right?
Correct.
Some people refer to as intermittent fasting, but we typically start people on 11 to 4 regimen. Sometimes we'll shift it earlier or later. But the earlier time, is more physiological in terms of your feeding, ideal feeding time. So, okay, a week he's off his meds, and what was he able to do after that?
So he also did start on the infrared sauna and the beamer therapy, and I think that actually helped his joint pain go down as well. And then as his weight really started coming down, he was able to move around more, and he was able to kind of start exercising, because he lost 25 pounds in 1 month, which is incredible.
Oh, wow. That's
and
impressive.
yeah, he was walking faster down the hallway, and I could tell he had less edema as well. He just looked more energetic when you saw him and spoke with him as well, which was good. And then he went back home because he was from out of state, and he was back home for another 2 or 3 months, but he stayed on the raw diet with the time restriction. So he was very motivated. And then when he returned again for 1 week to do more of the therapies here, at that point he had now lost 60 pounds, which was incredible. And it was very evident just looking at him and seeing him that you could tell he looked like a different person.
Wow. Yeah, he was a different person.
Yeah.
60, that's about 14, close to 15% of his body weight in that 3-month period of time.
Right.
Which is comparable to a lot of those GLP-1 agonists that are being promoted in terms of weight loss, but he did it without taking the pills. In fact, he reduced his medication and had the same results. In fact, he was not having to take the other medication. So the importance of it, and I mentioned the GLP-1 agonists, and it's a lot, the drugs, Ozempic and Wegovy and Mounjaro. These drugs that are very hot now, the Hollywood weight loss drugs. I think some people refer to them as. Lots of people are trying to get these medications. We've had some patients come and request it. And, I'm not against prescribing medication on an as-needed basis, but our approach is to help patients achieve long-term solutions. Outside of, say, a transplant situation, I don't see medications being a long-term solution for most people. So this is clearly a much more impressive finding. You mentioned infrared sauna. Can you share with the audience what the benefits of infrared sauna?
Yeah, so infrared sauna looks kind of like a dry sauna, but it utilizes infrared light, which the characteristics of that light help increase nitric oxide production from the endothelial cells of the blood vessels, so that helps keep your blood vessels open, lower blood pressure, improve circulation. And it's been shown in studies to reduce the risk of hospitalization and death in patients with heart disease and heart failure. So we've seen, amazing benefits in everybody, but because it improves circulation, it can improve more than just the heart. All of our tissues rely on good circulation. So that's where we see it also help people with joint pain or more systemic autoimmune illnesses too, because it's a natural systematic therapy to improve your overall well-being. So
there you have it. Again, here's a patient comes in, multiple medications, morbidly obese with high blood pressure, lymphedema, swelling, arthritis, and in many ways stuck. And so we started with an aggressive nutritional intervention. When you look at a situation like this patient, when he's morbidly obese, people say, well, he's sick because he's obese. I would say no, he's obese because he's sick. And the optimal nutrition doesn't necessarily cause weight loss, but it causes health gain. And when you achieve health gain, then weight loss is one of the many collateral benefits, along with arthritis loss, high blood pressure loss, kidney failure loss, and all the other losses. So it's not just weight loss we're going after. We're going after a lot of losses, but you have to start with the health gain, and then you get the sickness loss, and everything else follows. So anyway, there you have it for today. Until next time, take care.